Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet in New South Wales in Australia, and I'm talking today or yesterday over there to Debra Engelhardt-Nash in Charlotte, North Carolina. Deborah, nice to have you on the program. Thanks for joining us.
Good evening, my time.
Yeah,
hello.
And good morning, our time. And the funny thing is that it's your husband Ross's birthday, our time. His birthday tomorrow for you. But anyway,
yes.
Ross is off doing something else, and it's you and me talking for an hour. Deborah, you've been a dental practice manager. You've been in dental a long time.
I have.
And a long part of your life. So you've seen a few changes over the years. What do you see? Let's jump straight into the present, and what do you see happening now, and what do you see as being the big things that are going to happen in dentistry and dental practice management in the next 1, 3, 5 years?
Great question. I think that what had been predicted years ago is coming to fruition, and the prediction was that there was going to be fewer middle-of-the-road dental practices, and there was going to be a shift in high volume, low fee practices, and then there were going to be boutique, high fee practices. And I think in the United States, the dental service organizations are taking on, taking on practices, buying them, and creating, corporate dentistry is a thing. It's a big thing here, and I think it has an effect on younger dentists. Oftentimes younger dentists come out of school heavily in debt, as you know, and they use going into the corporate world as a springboard, oftentimes, for a guaranteed income, guaranteed patient base. So I think it's a little bit more difficult unless you have a very cavalier dentist starting to practice from scratch. I think more and more dental students graduates are looking at having the, kind of the ready-made practice, if you will. But I still think there's a place for that niche cosmetic aesthetic focused fee-for-service practice. And I think that that middle of the road is very scarce. And I'm going to give credit, Dr. Bill Blatchford, whom you know. He had actually had predicted that, probably 20 plus years ago, that was going to happen, that there was going to be a major shift. So I think that I'm not saying that corporate dentistry is bad. It's different. I think that young dentists, it's once again, it's a place for them, but it's not everything is cracked up to be. I also think dental insurance is, and I don't know, like where you are and throughout the world, if it's as predominant as it is here in terms of what that does in a dental practice. So by and large, if I participate in a dental plan as a dentist, I'm gonna take a cut in my fees. So I was just in an office on Friday. Beautiful practice, 3 doctors, 7 hygienists, 14 operatories. But he takes a lot of dental insurance. So one of the things we talked about was he has to create volume to make up for his 40% cut in his regular fees, as opposed to my husband's practice, which has been fee for service for 30 plus years. He hasn't accepted insurance forever, and we receive full fee. We have no accounts receivable. Our patients pay prior to treatment. And so we are a low volume, high fee practice, and we created a niche. So I belong to an organization. I think you've been to this meeting. I belong to an organization called the Academy for Private Dental Practice, and they work on perpetuating the model of private practice dentistry. And actually, even though a lot of people think that the corporate dental world is sort of taking over dentistry in America, it's still 50-50. It's kind of shifting, but there's still private practice dentistry. But I think that gone are the days that the dentist can be middle of the road. I think there's now sort of a point of definition. Um, and I think now also in a lot of the practices with whom I work and a lot of practices throughout our country, there's multi specialties in general practices. So you may have 2 general dentists, 2 or 3 general dentists, and then you have the orthodontist, the periodontist, the oral surgeon, the endodontist in that environment as well, and they work together.
That's interesting, because it's been, as you know, it's been 5 years since I've been to the United States, and I did spend a lot of time in the previous 12 years traveling back and forwards and learning what was going on in the US, because I felt that whatever worked in private practice in the US was going to work in Australia, and that was shown to be true. You know, some of the Invisalign open houses and things that I picked up on
Right.
those early tours really were successful down here. But you've quite surprised me that 50% of practices are now corporate owned DSOs, and of course, the stories I hear is that, you know, whenever there's a new shopping center opening and they want a dentist, a private dentist just can't go in there, because the DSOs will just pay premium to own the practice,
For the
for the
space.
space. So you can't do it.
Interestingly enough, I live in North Carolina. There is a school. There's a university north of me called High Point University. Very, actually, you know the president of the university. His name is
I
Nito
met Nito,
Cobain,
yes.
and you've probably heard. You know Nito. Nito's the president of High Point University. My daughter was accepted to go to school there, and she said, if the dean knows my name already, I'm not going to that school. So she chose not to go there because Nito knows her. But they are now building a dental school at High Point University, and it is called Heartland Dental School. Heartland is the largest DSO in the United States. So Heartland is funding the building of this dental school. And the assumption is basically it's going to be a training center for dentists to go to work for Heartland. The requirements are a little bit different than dental school. So this is going to be, this has kind of created a bit of a buzz, the Heartland Dental School.
It's interesting. The model that we have down here for dental schools is that the education that they get now is not enough for them to survive on their own in private practice, to walk out with a degree and start their own practice. In fact, one of my clients said that she felt that all her dental degree did was give her permission to go and work for the state government in one of their clinics. It was that basic. Like they didn't teach them anything in terms of business or even specialization. You know, the orthodontics was, here's how to write a referral, here's how to write a referral to an oral surgeon. It was really, really poor. And so maybe Heartland is anticipating, and that's the model that we have down here now, is that you you graduate, and then you find some generous dentist to mentor you on all the things that they should have taught you at university. And so the generous dentist
Yeah.
then pays with his time and his expertise, but then if the new graduate dentist working in that practice then starts to perform, he may then go and set up around the corner and become a competitor. So it's a weird model that we have down here, and obviously Heartland is now guaranteeing that they can cherry pick their really good students to stay on and work in the Heartland DSOs.
We'll see. So here's what kind of I think, not the problem in dental schools, but and I've actually taught in 3 dental schools. I've taught sort of the practice management, but you know this, David, as well as I do. What dental school does not teach the dentist is the human element of patient care. And when I used to do they called the 5th year, or the externship for the seniors or the juniors, and I think Dr. Mark Hyman, once again, is teaching at Chapel Hill now, and he's trying to teach that. But they say that they don't have enough time in dental school to teach them human resources and business and basic how to run a practice. That's why we have jobs, of course. So they learn basic clinical skills. And my husband was talking to one of the instructors at the school in South Carolina, because of our teaching center in Charlotte, and he was showing them how to prepare an onlay and an inlay. And some of the young dentists who come to the Nash Institute say, we were never taught how to cut an inlay or an onlay in dental school. And it's like, you were never taught. And so Ross called his friend, the professor at University of South Carolina, and he said, well, we don't have time to teach everything, and let's face it, insurance isn't going to cover an inlay or an onlay, so we just teach them how to cut the cusp and make a crown.
Gosh.
And my husband is like, he's conservative. My husband's a conservative. He's the reluctant prepper. So he says, save as much natural tooth as you can. And some of these young dentists are coming out of dental school saying, we were not taught how to do that.
Oh, that's scary.
It's scary. But 80% of the reason why the patients choose dental treatment has nothing to do with the clinical aptitude of the dentist. I mean, if I were to go to your dental office, Dr. Moffet, I don't know the tertiary anatomy of your crown. I don't know if you're a good dentist. What I know is how you make me feel while I'm in your care. And that's not something that they teach in dental school. So you can have a brilliant clinician, but if they don't know how to engage in patient relationships, then they may not have the case acceptance at a high level, as high a level as that person who maybe is a mediocre dentist. And I mean, I'm not judging dentistry, but you can have a great communicator, poor clinician, who will be more successful than the great clinician, poor communicator.
That's the truth, Deborah. And every dentist has had a new patient walk in and looked in their mouth and gone, oh my goodness, how is this stuff even there? And then they ask the patient, who was your last dentist? Oh, Dr. Jones, he was so nice. I went to him forever.
I loved him.
And I say, he was a great dentist. Some of this work, I don't know how he's gotten it to stay there.
I know. I will tell you that there is a magic question, and I have to give my husband credit for this question, because I've worked with him for now. He already had established his fee for service practice when we got together. I had already had my consulting business in Seattle, Washington. So we already both had our own businesses, but he did ask me to come in and work in his practice. I did double his net the first year, and I laugh. I said, I had to find a way for you to afford me, so I had to help you double your net. But it was about systems, because my husband's a brilliant clinician. He's not a business person. If he could do dentistry for free, he would. But he has got amazing people skills. And one of the most important question that he asks a patient moves a patient to yes almost every single time. And we're talking fee for service, average, major treatment plans. But so many times dentists tell the patient what they need. They do the clinical exam, they do the comprehensive exam, they gather all the diagnostic information, and then they sit down and they say to the patient, now we're going to tell you what you need. And my husband doesn't do that. My husband, first of all, one of the things we say is, we're going to gather the information to share with you to help you make the right choices for your care. So we're letting the patient know that we're going to put this in your court. We're gathering this data so that we can give you information to help you make the right to help you make choices. But then when my husband sits down with the patient, and I teach this to all of my clients, when he sits down with the patient, he says this: would you allow me to tell you what I'd like to do for you if you gave me carte blanche? He always asks permission. He doesn't say, I'm going to tell you what you need, and then Sylvia is going to go over your treatment plan and talk about insurance and how we handle your finances. He basically asks the patient permission to tell them what he'd like to do for them. And I have never heard a patient say, no, don't tell me, I don't want to know, ever.
Wow. Wow.
It's a brilliant
Yeah,
question.
so he's there asking him to explain what he sees. He's not telling them what he sees. He's not ramming it down their throat. They're asking
Right.
to hear it. That's so good.
And they actually say experts, whomever they are, whoever we say the experts are, you and I might be considered those people. They say that oftentimes the patient doesn't choose dentistry because they are released from the dentist too soon to go talk about money. And I always say the decision to accept treatment is the responsibility of the clinical team, not the financial team. My responsibility as the financial coordinator or treatment ambassador, whatever title you want to give me, my responsibility is to negotiate the terms of payment. But it's the clinical team's responsibility to help the patient understand and choose the treatment. And you've probably heard this in your years of consulting and your years in dentistry, where the patient comes to the front desk and they're still confused about what they're going to have done, or they'll say, "Is a crown the same as a cap? Can I do a filling instead?" Which tells me what? We didn't do a really good job of explaining, what we had to offer. So the yes to treatment really should be happening with the clinical team, and that would be the doctor and the dental assistant, or the doctor and the hygienist, the doctor and the treatment coordinator. That that group in the back.
Yeah. If the patient leaves confused from the treatment room, it doesn't matter how good the front office person is. If it hasn't been said by the dentist, it's very hard for the front office person to create that authority. If the dentist hasn't said, this is what we need to do because this will happen if we don't.
Yeah. Well,
this is what you want. This is what you asked me for. Yes.
yes. Yeah. Here's what's going to happen if we don't do this. I think the other thing that happens, and I always ask this question in my audiences: if you're talking to the patient about their treatment and they start asking you about money, what are you hearing? And so many times people will raise their hand and they say they're concerned about the money, or they're not ready to do it, and I say it's the exact opposite. You're thinking that the patient starts asking about money and how they can pay for the treatment. You're thinking it's an obstacle. And actually, when people start asking about money, they're ready to buy.
Yes. Yes, of course they are.
So many times though, and we talk about what's your belief cycle. If your belief cycle is they don't want it, they can't afford it, they're not going to say yes to it, insurance is going to play an important part. If that's the way you're approaching it, so when you hear somebody say, "Can you just give me an idea of what it's going to cost?" So many times I hear dentists and dental team members say, "Oh, well, see, it's too expensive for them." No, they just want to start negotiating terms of payment. They're ready to move forward.
Yeah, we hear this because Jane listens to clients on the phone and hears people actually saying, "Oh, that's very expensive." Tell me about the veneers. Oh, veneers are very expensive, and the person hasn't even asked what the price is, but the receptionist has labeled the thing as, "Oh, you don't want them; they're too expensive." That's often the belief system of the person working there as well. Sadly,
You're right.
and
You're absolutely right. Yeah, and here's another thing that happens. If I were to call, and I know Jane's really great at this, how she coaches people. If I were to call and say, "Hey, I'm interested in some cosmetic aesthetic dentistry. Can you give me an idea how much you charge for veneers?" Oftentimes, dental offices say, "I'm sorry, we don't quote fees over the telephone." Or before I can quote a fee for you, you're going to have to come in for a comprehensive examination. We're going to have to gather all the data, and then we're going to tell you. And that closes me off. I'm going, okay, thank you very much. I'm good. I'm on to the next phone call. So for me, it's not that I'm going to I'm not going to diagnose and quote over the phone, but I will say something like, I will be happy to discuss our fees with you. Be happy to talk about our fees because it breaks down that defensive barrier. I mean, they're shopping. There's nothing wrong with shoppers. I mean, we used to, your friend and mine, Jennifer D. St. George's, used to get really upset about shoppers. I'm a shopper. You're a shopper. We're shoppers. So it's okay. But if when someone says how much you charge for, my reply always is, I would be happy to discuss our fees with you. Before I do, may I ask you a few questions?
And that's exactly it. Because why are they looking for cosmetic dentistry? Do they have what's their reason?
Exactly.
Have they got an event on? Even just whitening. Do they need their teeth whitened for a job interview, for a date, for some or a clean?
Yeah.
Why do they need their teeth clean? Because their grandchild said, "Oh, Nana, your breath smells."
Yeah.
all those.
Yeah. Or how come, grandchildren say, how come your teeth are so yellow? We had a patient say that. My granddaughter asked, she said, why are your teeth so yellow? She said, I've got to fix that. I got to do something about that. So I think you're right. And I think, you hit the nail on the head too. When you said, oftentimes it is the team members' belief that, most people can't afford this, and that isn't true. So I think that's the important piece. The other thing that, when patients ask that, that's like, well, tell me what it. So obviously you're calling around trying to learn more about this service. What questions can I answer for you about it? And the other question for me would be, how did you choose us? How did you find us? What inspired you to call here? So my question would be, what inspired you to call? You obviously are doing some shopping, and I can understand because you're going to be making an important investment. So I understand why you're shopping. Tell me how you chose us.
And that's really important because often it's a recommendation. Often it's something that they spotted in your marketing or on your website. And it may be something simple that, Dr. Ross plays a bit of golf on the weekends or, in fact, it's funny. I was telling you beforehand that I'm going up to Sydney for 4 weeks to house sit. And as a person of habit, sadly, my 4 week haircut falls right in the middle. I couldn't go to see my guy down here before or after. It'd be too messy. So I contacted my previous hairdresser, who had been my hairdresser in Sydney for 18 years. And I was thinking that the first time I met him, I was recommended by one of my patients who said, she said, my family friends who don't travel to see me go and see this guy. So I went in there and he said, "Oh, what do you got planned for the long weekend?" I said, "I'm going up to Queensland to visit a friend." He said, "Are you going to play golf?" And I said, "Yeah." He said, "I play golf." And that was it. He was my hairdresser for the next 17 years. We played a lot of golf together.
Well, there
And
you
it was
go.
just that one bit of commonality that brought us together. So you never know. And a great question to ask, why did you choose us? What's brought you here? But it really, really.
I think that's, and I think that, I know that oftentimes when patients call a practice, and unless you're using, I mean, we have great telephone systems here. So we have Added, and we have Weave, and we have Mango, which are really great supportive technology, so that we can identify if a patient of record is calling, and we actually their picture pops up on the phone. But so many times I've heard receptionists, when a patient calls, will say, "Are you a patient of record? Have we seen you before? Are you having pain?" It's like, wait a minute. If I'm a patient of record, you should know I'm a patient of record. So that is why that's why we should employ technology. Have we seen you before? That could be offensive if David Moffet wrote me a check for $25,000 2 months ago for my treatment, and I'm asking, have we seen you before? Yeah, my check cleared. I know you've seen me before. So I want to make sure that the receptionist is very aware of that. So And as opposed to the question, are you in pain? It's that, tell me what inspired you to call. Tell me what inspired you to call today. There's a reason I made the call today. Find out what it is. And then they say, well, this is who I am. I'm a patient of record, or I am in dental pain. But I think that initial phone call, what do they say? They say, and I know you've done a lot of studying about human behaviors. You have about 15 seconds to make a good impression.
Yep. You only get
Yeah,
one
15
chance.
seconds to make a first
One
impression.
chance to make a great first impression, and you've got to get it right. And so,
Yeah.
Deborah, Jane says it. It's like baking a cake. You can't do the steps round the wrong way. You can't put the icing on and then put it in the oven. The icing's got to go
Yeah,
last.
right.
And so the first thing you always have to find out is who am I speaking to, and
Yeah.
the polite way is saying which one of our patients can we thank for recommending us? And they go, oh no, I didn't get a recommendation from your patient. I actually saw your advertisement. So it's always about saying instead of have you been here before? Yeah, like have I been there before?
Yes. Yeah.
He should name a room after me. I
I
paid for
know.
his education.
I bought his car. Yeah, and I think also, I don't know, in the United States, the first question in a lot of dental offices, the first question is, "Hi, my name is Debra Nash, and I'd like to make an appointment for new patient exam." The first question is,
Yeah,
"What insurance do you have?"
it's horrible. It's
It's
horrible.
horrible. So we wonder why the patient becomes so insurance dependent or insurance focused. We created that situation for them. Sure, we're going to ask about insurance coverage, but it should come at the end of the visit. It shouldn't be the focal point of the conversation. That should be, so I can help you with any coverage you might be utilizing for your care. Me ask you a few questions about, about any outside coverage. I think but that should be at the end. And so many times it's at the beginning. I mean, my responsibility at the reception, at reception, is for that patient to hang up that phone and say, wow, I have never been treated like that on the phone by any other dental practice before. And I can understand why their fees might be a little bit higher, but I can already tell it's going to be worth it. And that's my responsibility.
Well, the other thing that you want them to say is, I'm so looking forward to coming and meeting that lady. And it's not about the
Yep.
dentist. I'm so looking forward to coming and meeting her face to face because she was so nice. The other thing, Deborah, which you know, and a lot of people know it, but they don't really know it, and that is that 20 to 25% of the population out there don't care what the competitors charge for a service because they're so happy with the service they get from their provider, be it their hair lady, their nail lady, their lawnmower, their pool guy, their dentist, their doctor, that they're not going to change. And so price is elastic. But it may not be the same person who doesn't care about the pool. They might care about the price of pool cleaning, but they don't care about the price of dentistry when they've found a really great dentist. So you've got to work on finding that
Yeah.
niche, and or that pond, as I say. And when you find that pond, that pool of people who don't care what dentists charge, they're just happy that they found a great dentist. That's a really nice environment to work in. And
Well, and one of the things that I will say to patients when they ask about fees, and I know, I mean, once again, I work as a consultant. I work with a lot of insurance dependent practices. I work with fee for service practices, cosmetic practices. But I think I always say to patients, once again, I'd be happy to discuss our fees with you. They're based on three things. Our fees are based on the skill required to do it right, the time it takes to do it well, and the materials that we utilize, the technology that we employ, the laboratories with whom we partner, and the professionalism of our team. So we know that you are going to receive extremely professional care and your results are going to endure and you're going to be satisfied. And that's how we base our fees. So then I will also say if I'm answering the phone in my excuse me, my husband's dental practice, I will say, if you are looking for the dentist that has the lowest fee possible, we may not be the dentist that you choose. If you read our Google reviews, you're not going to read that we were that we were cheap or the least expensive. But if you're looking for the dentist who's going to give you the results that are going to be long lasting, that are going to be that's going to be exceptional. If you're looking for the practice that's going to be very attentive, very compassionate, very thoughtful, and very comprehensive, then we're going to be the practice that you want. So if you're looking for low price, we're not going to be we're not going to be your practice. We're not going to be right for you. So I recommend being upfront about that. It's not for us. It's not about our fee. And our Google reviews, you'll see, it's not about our fee. It's about the quality of care that we provide and the manner in which we do that, and the respect and the integrity that our doctors provide for the patient.
So you raise a good point there, Deborah, and that is that Google reviews are really, really important, even in 2024.
Huge.
And, everybody gets a bad review. And I think if you don't have a bad review, I think there's something really wrong, because you can't please everybody. But it is really important to ask for Google reviews, and it is really important to thank patients who give you good Google reviews as well.
Yes, and I know in certain states in the U.S., you cannot incentivize a review, and you can't incentivize a patient for referring a friend. So in North Carolina, we're very conservative. I can send a thank you note, but I cannot send flowers. I cannot send theater tickets. I can't. There's no way that I can thank a patient monetarily. I can't offer a discount on their dentistry for referring a friend. That's just and there are certain states that don't allow that. I cannot incentivize a Google review. The only thing I could do if I wanted to inspire more patients to do reviews, I could have a raffle. So, leave a Google review and your name will be entered to win this prize, whether that be a basket of dental goodies, dental treats, or a gift certificate to a restaurant. But that's the only way you can do that. I think it's important that QR codes, I think, are huge on websites. I think it's very important to have a Google review QR code on your website. And as the patients are leaving the practice, to have some, even it's not going to replace asking for the review, but having a QR code that the patient can take a photo of makes it easier for them to do that review. So there should be a QR code that's convenient for the patient to see. I was in, it actually happened a couple of weeks ago. Dr. Nash had a patient who had veneers done by somebody else, and that dentist was unavailable. So he ended up re-cementing a veneer, and she said, I wish I had come here. I can't believe how well I'm being treated here. I'm being treated here better than I was treated in that other office. And I mean, I just can't believe what a mistake I made. And I said, one of the wonderful ways you could compliment Dr. Nash would be to let people know by submitting a Google review, and let me bring you the QR code to make it easy for you, because it would really be a compliment to Dr. Nash to make that statement online. And then Dr. Wormlinger had a patient, and it was an older woman. Her daughter was with her, and she said, I just love it here, and I just love Dr. Wormlinger, and he's so kind. And I said, it would be really great if you would share that on our website, on our page. And the daughter said, here, let me do it for my mom, because she doesn't know how to do that. So I think, once again, getting the team to know, to pick up on when a patient pays a compliment and says, you guys are great, or, oh my gosh, I love this office, or I love my results. The team needs to be inspired and to encourage that patient to say, you know what, the nicest compliment you could ever give the doctor would be to submit a review and let people know about how you feel about our office.
Yeah, it is so nice. And it's also, I didn't realize I don't do many reviews I don't go out much, but I love how Google keeps sending me lists of how well my photos are being viewed, and how well my reviews that I have. I've done less than 10 reviews, but some of them have got huge numbers in terms of appreciation by people looking for those restaurants and those places to dine and whatever.
See, I always review because I know how important they are. So we were just out to dinner. I told you where we went for, Friday night for my husband's, and it was a wonderful experience. So they sent me so glad you dined with us. Would you mind leaving a review? And I immediately go on and do that because I know that's important. I also, when we talk about team, I'm a big fan, and I think it's really important for team members to understand the importance of endorsing the
Oh, yes.
doctor. Most doctors do not walk into an operatory or into a clinic and say to the patient, I am really good and you are really lucky to be in my care. I'm an exceptional human being. They don't do that. They're very humble. They want to be liked, they want to be likable. In fact, some dentists are so shy. Oh, and they're almost afraid to give the patient a comprehensive treatment plan because they're afraid they won't be liked. But I think most dentists don't walk into an operatory and say, I'm good, or I'm wonderful, or I'm exceptional. Pardon me. I came home from Kenya with a little bit of a cough. So I think it's important for the team members to set that up. So if I were your assistant, I would turn to the patient and say, can I tell you a little bit about Dr. Moffet and about his exceptional care, his chairside manner? And can I tell you why I'm here? I mean, I've been working for Dr. Moffet for 12 years. And the reason I've worked for him is I really admire his quality of care. I admire how well he takes care of the patient. I also admire the respect and integrity he demonstrates to me as well as to our patient. I think it's important that because the patients now, well, I want to meet this person. So I think I think there needs to be a pre-introduction about, before the doctor walks in by the member of the team. I mean, it probably happens on the phone. I always say on the telephone, my end of my conversation on the phone is, may I tell you a little bit about the doctor, whether it be Dr. Nash or one of my clients, if I'm doing some team training. And I'll say, not only is Dr. Nash a brilliant dentist and a dental artist, but he's got a great chairside manner. He's affable, he is humble, and he will give you all the time you need to help you make the right choices for your care. His mantra, if you will, is he's very conservative. He believes in saving as much natural tooth as possible. And his mantra is, if you do the right thing will always happen. So Dr. Nash's, his goal is always do the right thing for his patients. So I give them I tee that up at the phone call. And then when the patient comes in, once again, everybody should have, we call it the magnet story. What is my story? Why am I there? Because I become the second opinion. How many times does a patient turn to a dental assistant or a hygienist and look them in the eye and say, should I believe this? Should I do this? Is he good? They may not voice it, but boy, their eyes, and you've had it happen, right? Where the patient looks at your assistant. Yeah.
Yeah.
So they become that second opinion. And I actually was in an office in Toronto, Dr. Moffet, you will not believe this, but at the front, there's 4 offices owned by one dentist, but he has multiple locations. And one of the receptionists for one of the locations was sitting at the front desk or the front row. And I said, tell me what you tell patients about the practice and about the care that you receive as a patient. And she said, well, I don't have my work done here. Mm-hmm. I said, what? Excuse me? She said, I don't go there for my dentistry. And I said, you don't go to the doctor for whom you work? You don't have your work done here? And she said, no, I go to another dentist. I said, what do you tell patients? What do you say to the patient? Why aren't you having your work done there? And she said, well, it's a long story. I said, okay. Wow. Interesting.
Yeah. What?
That would bear a private conversation
what you doing
with that
working
person
there?
for me.
Yeah.
I know. Yeah.
I keep.
Yeah. I didn't want to belabor the conversation. There were 65 people in the room, but it's like, man, I went to her manager later. And I said, I think that bears a conversation. Why isn't she sanctioning that practice by being a patient there?
Scary.
Because I think that's that's important. I was at Friday, the office I was in, great dental assistant, and I said, "What's your story? What do you tell patients?" And she said, "I tell patients I was a patient before I came to work here, and my family comes here, and I come here, and all my friends come here." That's the
Yeah,
story.
that is the story. Deborah, we've touched on a lot of the intangible stuff, the heartfelt stuff in terms of building a great practice. But as a practice manager, you've still got to go and show dentists results, money, bottom lines, and things like that. What are the key metrics that you recommend that practices look at? And
I love talking about that.
and what are some metrics that they measure that you think, why are you measuring that? It doesn't have any bearing on what you're doing.
Great question. Metrics. Yeah, because I don't think dentists look sometimes at the right numbers. I mean, they look at production, they look at collections. Everybody does that. They look at they look at the number of new patients, and that's pretty standard. But what the other metrics that we need to measure, not only do we need to measure how many patients are coming in, but we also have to measure attrition. How many patients are going out? How many patients are we losing? Um, and for me, I not only do I want to know how many new patients are coming in, I want to determine their value. What is the value of that patient coming in? Am I attracting 50 new patients a month and their value is $400? Or am I attracting 20 new patients a month and their value is $4,000? So I want to also be tracking what is my average diagnosis rate? Because I may be looking at a doctor who's not diagnosing a whole lot of dentistry. Um, and so all of their treatment plans are very small. So and once again, that's their choice, and that's their culture and that philosophy. But I will say to the doctor, now, if that's the way you want to diagnose, then you're going to need more people. You're going to need more patients. If you want to change your treatment philosophy or become more comfortable doing another level of dentistry, then your requirements for new patients will become more minimal. That'll change your marketing plan. That'll change the dollars you have to invest, and it may change the demographics and the psychographics for whom you're looking for. So I want them to determine not only how many new patients, but what is your average treatment plan diagnosed per patient, and what is your acceptance rate? So if you are diagnosing $5,000 and the patient says, well, can I do half of it this year and half of it next year? Then you have a 50% treatment acceptance rate. They agreed to half of that care. So you want to take a look at, so you have a 50% collection rate. Well, the average, you're never going to get 100% acceptance rate. If you're presenting comprehensive dentistry, unless you are phasing treatment and altering the plan, if you are presenting at $20,000 and $30,000 cases, you're not going to have 100% of the people say yes to $30,000 100% of the time. But you should be shooting for the mid 70s. So the average in the US, the national average is about 76% case acceptance rate. And the other metrics that we should be looking at, I do want to take a look at recall return rate. We'll talk about it in a moment, and capacity, because about 35% of established practices, 35% of their production is going to come from treatment that had been planned, not scheduled by a hygiene patient. And so many times, doctors are looking for more new patients to fill their production schedule. And it's like, wait a minute. How much dentistry, another metrics they need to look at is how much unscheduled treatment do you have in your current records?
Yeah, yeah. A hygienist from the US once told me, maybe 12 years ago, that a good hygienist in the US will pre-diagnose for the dentist somewhere between $5,000 and $10,000 worth of dentistry a day out of their
Yeah,
hygiene
oh,
room.
absolutely.
And a lot of dentists are always go, I just need more new patients. They're ignoring these are the loyal patients who you don't even the dentist just rubber stamps what the hygienist is suggesting.
And yeah, or here's the other thing that happens. We can have a whole other conversation about this. Doctors are looking at how many hygiene patients can my hygienists see per day. So we're going to shorten their time and get more people in. So my question always is, all right, so maybe they can do certain muscular motions per minute and shorten the time. But are you giving the hygienist any time to have a conversation with the patient about unscheduled treatment or treatment that he or she has found? The question that a hygienist, and I'll tell you a funny story about hygiene and strengths taken to weaknesses, but a question that the hygienist should be asking a patient of record who has unscheduled treatment, the first thing that should happen when the patient comes into the treatment, into the operatory, isn't let's get your radiographs and tell me about your cats and let's talk about casseroles. Excuse me. The first question should be this: David, I see that there's treatment that Dr. Wilson has recommended for you that has yet to be completed. Tell me what has prevented you from having that done.
Yeah, very good question. Yeah, let's.
And then I'm going to let the patient. And then we have to train our team. And I know Jane does this. So let's say the patient says, well, it's cost, it's money. So David, think about this. If money is a factor, think about if we had done this 5 years ago when doctor first recommended it. And think about if we wait. So if cost is the factor, it will never cost you less than taking care of it now.
Yeah, yeah.
And then they'll say, then the other, and so we have to teach our teams how to answer this. And then the other one will say, well, it's not bothering me. And that is our objective. Our objective is to get it, to take care of it before it bothers you, because when it starts to bother you, it's going to probably be more costly. It's going to be more time consuming. And we're all about prevention here. That's what we do. So when you tell, I want to wait for it to hurt, that's just not a good suggestion. That's not something we would want to do for you. So if I can find a way to make it affordable, if we can find a way to put that into your budget, what other concerns do you have about moving forward with this care?
Yeah, they've got to want it, haven't they? And that's.
Yeah, but I think we have to give the hygienist time, and it's not, gee, if you feel like saying this, Deborah, as the hygienist, if you feel like saying this today, would you? No, this becomes part of the regime. Now, the other thing that happens, and this is a kind of an interesting story. So my first husband, John, and he's British, and that says a lot about his philosophy about dentistry. But John is from Watford, from England, but John called me one day. He lives in Seattle, Washington. I happen to know his dentist, excellent dentist. He was my dentist when I was there. John calls one day and he says, Deborah, could you help me with some verbal skills? I need to call and contest my the fee I receive for my hygiene appointment. And I went, what? Why are you contesting that? But okay. What's the problem, John? And he said, well, I got charged for a recall exam. And I said, well, John, when Don came into the room, when you went to the dentist, did Don come into the room, into the operatory? He said, yes. I said, did he have some little pointy instruments in his hands and he went in your mouth with them? And he said, yes. And I said, well, so what's the problem? He did an exam. He said, Deborah, he asked me about you and Sophie, our daughter. He asked me about Ross. He asked me about the movie I'm working on. He asked me about my dogs. We talked about my life living on the coast. He said, it wasn't a dental visit. He said it was a social call. He said, most of the time Don spent with me was social. Why am I paying $130 for a social visit? And I went, that happens a lot of times. Any strength taken to excess becomes a weakness. We have spent so many years saying, create a relationship, they're part of our family, make them, talk about their lives, talk about their kids, talk about their cows. But if you take it too far, then the patient says, I don't want an exam today. I just want to have my teeth cleaned. They don't see the value in the recare exam. And I'll tell you, in fact, I tell the story and Ross said, man, ever since you told me that story, Deborah, I have really paid more attention to how much time we're doing a clinical exam during
Are
recall.
you over there? Do you have the hygienist do the exam?
No, no, the doctor comes in and does the exam.
It's something that I developed for that reason. Was that, if they saw the hygienist and I wasn't there, then they'd say, "Oh, I'm not
Uh-huh.
getting an exam because the dentist's not here." And so then next time they come in and I am there, they say, "Oh, I don't want an exam." So all of a sudden, I've I'm still giving them the same amount of time, and so we wanted to make sure that they believe, because some patients will believe that a hygienist is a dental assistant who can clean teeth, and other patients will believe that a
Oh,
hygienist is as good as a dentist, they just can't drill teeth. And I want them to think of the hygienist as being as good as a dentist, but they just can't drill teeth. Just in the same way that when you go for an ultrasound when you're pregnant, the the radiographer knows what she's got to get on the image to show the radiologist because that's her job. And so when the
right.
patient says, "Is it a boy or a girl?" she goes, "Oh, I'm not allowed to tell you." Well, she knows what it is, just like the hygienist knows what the K is, knows what a cracked tooth is. And so
Sure, sure.
we developed that the hygienist would then, "I'm going to get a photo of that. I'm going to take an X-ray of that. I'm going to show David." And they go, "What do you think he's going to do?" Well, in most cases, this is what he would do. All right. So they're not saying he's going to do this for you, but in most cases. So then when I come in, they go, I say, "How are you today?" And they go, "Look at that tooth up there. It's got a big crack in it." And I go,
Yeah.
what did she say I was going to do? She says you're going to put a crown on it. Let me have a look. You know what? She's right. And so the
So they become a co-diagnosis for
yeah,
you.
so the co-diagnosis is really important. Um,
I
in that
agree.
sort of situation. But the other thing that happens in a hygiene room, as you know, is that in some practices, the dentist only comes in at the end, right? He looks at a clean mouth and he sees everything. In other practices, the dentist comes in when he feels like it. And so he's seeing a half dirty, half clean mouth. He's seeing a dirty mouth, not clean. It's like going to your favorite restaurant. They say, "Look, tonight we're going to start with the dessert. Then we're going to bring the oysters, and then you're going to have the steak at the end." And you go, "That's not how it's meant to be."
Yeah.
So your regular hygiene patients know the routine. So for, and the worst one is when the dentist, an associate, like I've got a practice at the moment where there's 4 or 5 associates, and the hygienist says, "I just have to take whichever dentist is available." So it's a real commodity there. And sometimes there's no dentist available, and the patient's got big work to be seen, and they cool down in a cooling down room, and then they get called back in. And
Wow.
so you've, we trained very hard on making sure that the dentist comes in between the 40 and the 50 minute. It's an hour appointment, and that's when they're always going to come in, and the patient's all hygiene's out of the way. There's another one of my clients real early on. She said, spent a long time explaining this treatment plan. She said, "I'll leave you with the hygienist," and the hygienist coming back at the patient with floss. So guess what? The patient walks out remembering how to floss their teeth, not that they've got to make an appointment for a big case.
Exactly. I think you're absolutely right, and I love the fact that in fact this just happened Friday with the office I was in, and they said, well, the relationship with the patient feels that the relationship they have with the hygienist is more important than the relationship that they have with the dentist. And I said, that could be a bad thing, but it could be a good thing, but it could also be a bad thing. Why is the relationship between the hygienist and the patient more important than the relationship between the dentist and the patient? Because, and I said to them, I said, I understand how much you love working for this doctor. I understand that. But if you won a $49 million lottery, would you still be there? And she said, oh, I would still want to work here. I said, okay, let's be honest. Okay, let's say you're going to come back and work, but you're probably going to take a 6-month vacation. Okay. You just won $49 million. You may or may not be here, but he will always be here. So shouldn't the relationship between the dentist and the patient be as critical as the relationship with the hygienist and the patient? And I've actually also heard hygienists threaten. They've said, man, if things don't change around here, I'm leaving and I'm taking all my patients with me. And it's like, wait a minute. First of all, that's a HIPAA violation, and you can go to jail for that if you can't contact the patient when you leave. But they feel like that the patient's allegiance to them is more important than the patient's allegiance to the doctor. So I understand efficiency and effectiveness. So here's one of the things I often recommend to doctors. I said, I want you to think about the American Dental Association recommends the patient's records are renewed about every 3 to 5 years. So they're suggesting that, you let the patients know that it's time for us to update your records, gather new data. And I said, I would want you to take that appointment. And also I call it the recall renewal exam. I want you to renew your relationship with that patient. You're not coming in and doing the flashing blue light special, dine and dash and walk in between impressions. I want you to come in and spend a little bit more time, renew your relationship with that patient, renew your office philosophy, your culture, remind them of how important they are to you, sort of like a marriage vow. Let's renew our vows to that patient. So I always tell the doctor that at least every 5 years you should be coming in and letting them know how, if you're not doing it every year or every recare, let them know it's time for us to gather new baseline data. It's time for us to, let's walk through your mouth. Here's where you were when you were first patient. Here's where you are now. Let's talk about where we're going in your dental future. And I want to really thank you for your trust that you've had in me for the last 7 years. Thank you so much. That means so much to me. And the number of friends that you've sent to our practice, that's really we really strive for that. So thank you so much. And there's nothing like, I mean, you could send thank you notes and you could do all kinds of marketing. There's nothing like the dentist looking the patient in the eye and saying, "You are important to me." And the number of friends and family members you've sent to me, they're also important to me. And I want to thank you so much for your loyalty. It means the world to me. I think there's nothing like that. That's sincerity.
I think I agree wholeheartedly, and we emphasise that with our clients to say that at the end of every treatment appointment, thank them for their
Ah,
time, and thank
nice.
them for being a great patient, and thank them for their loyalty. It's American Express did it well, didn't they? They put it on the card, member since 1984, and you should be saying, you've been coming here since 1984. You have your staff say that. Well, you've been coming here since 1984. What brings you to this office?
That's,
I've only been here like 2, 3 years, but you've been coming a long time. Get
yeah.
those conversations.
Yeah. And that would be a great question for a new associate. And to say, boy, I'm so glad to be I'm part of this practice. And I see you've been here since 1984. Tell me, what is it about this practice that keeps you here? Because I want to perpetuate that. I want to make sure that I am meeting those expectations that you have.
It's fun. It's funny. What part of my practice was I had a neighbour in the rooms next door. He retired. I bought his practice in 1998, and it was his father's office before that, back to the Second World War in another building. And so when I left in 2014, one of his patients said to me, she actually asked that I be called back out of the operatory, and she said, "Oh, your wife's just told me that you'll be leaving now." And I said, "Yeah." I said, "Yeah, thanks for being a patient." She said, "Oh, I wanted to thank you for looking after me for the last 17 years." And I said, "Oh, that's fine, but you were Ken's patient before that." She goes, "Oh, him. All he ever used to do was say open wide, and then an hour later he'd say that's it, and that was it. He never said boo. He didn't ask anything about me." I'm going, "But you saw him for so long." So people do tolerate that, but they do notice the difference. They do.
Yeah. And you know what? They actually have proved, then there's, I usually run some statistics when I'm doing my presentations, that they have actually proved, first of all, 91% of patients who leave a practice will leave without complaining, even though they're not happy. But they've actually said that 51% of our population, and this is American population, will pay more for a service if they feel important. If they feel important. And oftentimes they'll say it's the employees or the members of the team that make that patient feel important. Think about this. And in fact, I tell the story too. I live in an area in Charlotte. There are 5 steakhouses within 2 miles of my house. There's and they're all very prominent, but there's one steakhouse. And David, if you ever come back to Charlotte, we'll have to go there. There's one steakhouse. First of all, it's called Steak 48. It takes about 5 to 6 weeks to get in with a reservation, unless you know someone. My husband makes a phone call, but We kind of know people there. But out of 5 steakhouses, that's the one that everybody wants to go to. Is it about the meat? Is it about the cut of the meat? It isn't. It's about the way they make you feel from the moment you pull up to the front door, whether you're driving, if you're riding in a Kia or a Bentley, it doesn't matter. They make you feel like you are a VIP on a red carpet. And from the moment that door is opened by the doorman and the moment they greet you and take you to your seat, it has nothing to do with the cut of the meat. And you're paying $80 for an 8-ounce filet. Not with wine, with sides, that doesn't even include nothing. But it's the experience. It's the experience that you have.
Yeah, and without an experience, Deborah, as you know, you just become a commodity. Your business becomes a commodity, and then what are you left to compete on? Price.
And that's it. That's good. I was just going to say, and then we're going back to, so if you're not offering me any bells and whistles, what am I paying for? I always ask the question, and you all know about McDonald's, and I say, does McDonald's have quality? And people say, no. I say, wait a minute. Quality is subjective. So when you're talking to your patients about quality, you have to define what you mean by that. McDonald's does have certain qualities. It's efficient. It's convenient. It's predictable. It's cost effective. So for some people, they would say, well, those are great qualities. It's a big difference than fine dining. There's a huge difference in the quality of the McDonald's experience than the quality of going to a fine restaurant. So if you want to charge your patients fees that reflect fine dining, you have to behave as though you're in a fine dining restaurant. You can't perform like you work at McDonald's and then charge a fine dining fee.
No, you can't. You can't. And it's a shame that it is the McDonald's name. I often say, when people say, well, tell me about your coaching, I say, well, look, I'm going to turn your practice into a better version of your practice. I'm not going to turn it into a Moffet practice. I'm not going to turn it into a McDonald's practice. It's going to be a better version of you and what you want from your practice. And I think that's, whenever we look at that in helping our clients and then they're helping their patients, I think we're still doing the right thing for that portion of the dental population. Deborah, we've run over an hour in talking. We could talk for another hour. And I know you've got a call to go to, and I've got something to go to as well. So, Debra Nash, thank you very much for being a guest on the Ultimate Dental Podcast. I really appreciate you taking the time, and with it being Ross's birthday tomorrow and all, wish him a happy birthday. But Debra Nash, thanks again for being on the Ultimate Dental Podcast.
You're welcome. It's great to see you. Great to see you. I love spending time with you.
Deborah. And at the end, we'll have the how to get people can get in contact with you as well. So thank you very much.
Okay. Terrific. Thank you.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.